Now, the Eastern Cape Department of Health, together then with the Nelson Mandela Bay Municipality, wants more people to make use of their mobile coronavirus testing stations as the fight against the spread of the virus continues. Now, since the launch of the mobile testing units late last year, it seems that the public at large is actually unaware that they need not make an appointment to get tested at the mobile units. The drive is now to tell people that you can just arrive and get tested. Another concerted awareness campaign in the metro is kicking off as well today in that metro. Andangonji has more.
As the Nelson Mandela Bay Municipality continues to see a drastic drop in COVID-19 cases, the municipality is still adamant and determined to raise awareness and share information as to ways residents can keep themselves and protect them from this deadly virus. Well, as you can see right behind me, that currently the testing session is in progress and a number of people have come out to get their tests for absolutely free. This as the Department of Health together with the Nelson Mandela Bay continue to encourage people to come out for their own sakes to know their results so that they can not only protect themselves but also those they stay with, especially those who might have pre-existing conditions. We have seen people come out today saying that they are here to get tested, and some of them not even having symptoms yet but saying that they just need to know their statuses so that they can continue to keep themselves safe and so that they can take action if they find themselves to be positive. The Nelson Mandela Bay has also seen a dramatic decrease in the number of people who would be roaming around the streets, especially around the curfew hours. This comes right after the enforcement of the new level 3 that has made sure that people adhere to certain intensified regulations, with some including the curfew time and with some also including the closure of places that sell alcohol like taverns. But right now I'm going to speak to a representative from the Department of Health, specifically in the Nelson Mandela Bay, Mam Sonia, to tell us more about some of their strategies they've put in place to make sure that these residents are able to beat this pandemic. A very good afternoon to you.
Afternoon.
Let's just start by talking about, the ways in which you raise awareness. I understand that you've got quite a number of testing stations and they have been rolled out for a couple of months now. But how do you make sure that residents come here and that residents know about this?
We've got a strong partnership with the department, with other departments, but mostly with communication with the Department of GCIC. We've got a strong partnership with the municipality in terms of communication. They are using a different number of communication platforms. We use your Facebook for the municipality and your Twitter accounts. And we also use our local radio stations. Every morning now, they are announcing where the testing sites are. So in that sense, that people can access it from mass media and even social media as well.
And I understand that you don't go to same areas each week. Can you just give us an idea of how you get to determine where exactly the mobile testing clinics will be based for a particular week?
What we do every morning, we've got a report that we generate that gives us tests for that for the last 24 hours and for the last 7 days. So what we do, we generate stats for the last 7 days, and from that stats we are able to determine now which areas had high numbers. And then from there, those will be our hotspots for that 7 days. That will help us to plan for the following week. And in that sense, then we are able to determine which sites we'll be using to test. And the advantage of doing this evidence-based planning is that we are also able to guide other sister departments that want to assist us. Because whilst we are not together, even right now, but you'll find that every Monday, every Friday, we share the information to them. So as they plan in their department, our planning is in sync because we are planning towards reducing COVID, because everybody is at the same platform in terms of where to focus.
And we do know that we do have areas that are quite rural within the Nelson Mandela Bay. How do you ensure accessibility for everyone?
That is one of the reasons why we are using the mobile services. instead of using a fixed facility approach. Because with the mobile services, we are able to go to areas that are not accessible. And in those areas, we are guided by numbers. For example, in this area, you might find we are in a parking lot. But when you go to Motherwell, you'll find us in the mall. Because we identify areas where people converge mostly in that specific area. So even in your rural, we don't have rural areas per se. We have what we call hard-to-reach areas. In those hard-to-reach areas, then we identify a center of convergence in that area, and we use that as the testing site.
Okay, and lastly, before I let you go, can you just take us through the whole testing process from, the time a person discovers that they have got symptoms, especially now using these mobile testing clinics, because many people seem to be of the impression that it's still going to the doctor, getting a confirmation, and then, having to pay 860, with many saying that they can't afford that much, and most resorting to staying at home or rather going about their business, saying that what they don't know won't kill them.
That mentality, I'm not going to lie, it was there some time before we roll out the program, but now that we are rolling out the program and we are announcing it, we are publicizing the service of the free service, actually, people are coming and they're using the service. And as a result, we are seeing those benefits where we are saving people money, because now people know that you don't have to pay in order for you to know your COVID status. And even those that are sitting at home, they are doing so knowingly. The advantage of the COVID itself, the testing that we are doing, yes, we are doing it to determine the extent in which the virus infiltrated in the community. We are also doing it to make sure people get services quicker, so that they don't stay at home, as you are saying, and then demise at home. But we are also using it as a platform for education. So as we sit here, you'll find that we've got food soldiers that are, for example, the Right to Care NGO. We've got food soldiers from the municipality, even our own food soldiers that are going into the nearby businesses. They are meeting people individually and as group, and they're educating. As a result, the people sit at home because they know either they might not need the service at that moment, but they know also equally, if they do not need the service, all they need to do is to go to the municipal Facebook account or listen to the radio, and they will know where to go.
Thank you so much. Well, that was Sonia from the Department of Health in the Nelson Mandela Bay District, encouraging the residents to actually come out and get tested, and saying that they have decided to introduce the mobile testing clinics to make sure that they are accessible to everyone, and to make sure that people do come out and get tested, and also mentioning that they have been rolling out this for quite some time, and that they will continue doing so, especially in hotspot areas. Like, for an example, we understand that this week places like Lorraine, starting with this particular place, Algoa Park, will also see a clinic of this nature, which is absolutely free, which does not require anyone to first go to the doctor to get approval or get confirmation to come to the clinic. And she says that people should come out, they should get tested and not wait until it's too late, especially when they are already experiencing symptoms. But right now, from myself, Anna Ngonji, and colleague Mcebisi Slengile, it's back to you in studio.